Also looking at health disparities this afternoon and their impact on minority communities, including those related to neurological conditions. Hartford Healthcare started an initiative to help address these disparities called the Healthy Brain Series for Black and African Americans. Here to talk about it is Dr. Lisa Knopf. She's a neurologist at the Epilepsy Program of Hartford Healthcare's Air Neuroscience Institute. Thank you very much for joining us this afternoon.
Thank you so much for having me. It's good to be here.
Yes, a very interesting topic right here. Tell us about neurologic conditions that can affect the Black and African American communities disproportionately.
Sure. We know that Black and African American people across the United States have a disproportionate rate of poor outcomes and mortality across a wide range of neurologic conditions. They're 30% likely to see an outpatient neurologist versus whites, even after when we account for demographic, insurance, and other health conditions. Also, once they have a neurological diagnosis, they're more likely to receive their care in the emergency room, to have more frequent hospital stays, and to have higher associated inpatient costs once they're hospitalized. Now, I'm an epilepsy specialist, as stated, and within the condition of seizures and epilepsy, Black people are known to have poorer access to specialized care. They have poorer access to brain surgery for epilepsy when it
looks like we're having a bit of a problem there with our Zoom connection. We'll kind of hold on for just a second to see if it comes back. Of course, definitely an interesting subject matter because we want to continue to follow along to find out what the... All right, I believe that Lisa's back now. Doctor, can you hear me?
Yeah. Yes, thank you. So I was just speaking to epilepsy and that Black and African American patients have lower rates of adherence to anti-seizure medications and increased mortality from epilepsy as well. And we can't speak about this topic without also addressing the role of interpersonal and structural racism in neurology. So with regards to structural racism, excessive poverty, worse health insurance, and poorer access to neurological and preventative care can impact disparities in outcomes from neurological diseases.
So let me jump in here and ask you real quickly. So how is the Institute's Healthy Brain Series addressing these health disparities?
Thank you so much for asking. So the Healthy Brain Series is a series of monthly lectures for the Black and African American population in Central Connecticut, which is held at the First Cathedral in Hartford. It's a series of lectures addressing different common neurological conditions. I will be speaking about epilepsy in my upcoming lecture next week. The goal isn't just to teach about neurological conditions, but also to create a forum where we can speak with folks and they can speak with neurospecialists about their concerns with questions about symptoms and, if appropriate, to navigate access into neurological care. We know that Black and African American people are less likely to see specialists, receive medications, or take advantage of advanced treatments, and we want to help change that in whatever small way that we can.
All right. Thank you, Dr. Lisa Knopf, for all the work that you're doing and for joining us on today. And Happy New Year to you, by the way.
Happy New Year to you, too.
All right.
Thank you so much for having me.